The NHS is going to struggle to survive unless we actually reform social care. And successive governments have failed to do so. I was very proud the Liberal Democrats in government actually legislated to reform social care. When the Tories got in on their own in 2015, they shelved it. Until you start to fix the problems in social care, you will not be able to release the resources the NHS needs. That's why Liberal Democrats have proposed, for instance, increasing the minimum wage for social care staff by £2 per hour so that we can start to fill those gaps in social care.
But what about the funding? What about the funding model for social care? Because the reason it hasn't been brought in by successive governments is it's been too difficult to do, and voters have rejected those ideas.
Well, on the plan that I've just suggested to you about increasing pay,
that's one part of it.
Suggested would be paid for by a gambling tax, and we know that gambling, as we heard in PMQs, has a massive impact on the NHS. But more broadly, Liberal Democrats have long said that you do need a cross-party commission consensus. At the last election and the previous election,
and how long would that take?
We proposed a penny on income tax to pay for health and social care. We need to reform social care, and we need to prevent ill health as well, and that means tackling many of the things like whether that's junk food advertising to children, whether that's tackling gambling and other online harms that have a devastating impact on people's mental ill health.